These are the common questions asked by AMC panel.
Good.
Good
I'm good,
evening. Good
sir.
evening.
Thank you. How are you?
I'm fine. So today I will send you some questions. Just
Yes,
now these
sir. Yes,
questions
sir.
were asked from candidates. So first I want you to
Oh,
speak
okay.
on snake bite.
Okay. About snake bite.
Of course,
All
yes.
right, sir. Yes, sir. Snake bite, when the patient comes with a history of snake bite, first what you have to do is make sure that the limb of the patient is immobilized, and you have to reassure the patient. So after that, you have to check for any local reaction on the site. So if it is there is a difference between the different types of snakes that is found in India. So if it's a viperoid bite, that means that it is a hemorrhagic manifestations would be there. So on the bite site, for a viper bite, there can be local reaction like bleeding marks, or bleeding might be there, and there will be edema. So all those signs are suggestive of a viperoid bite. So if it is a viperoid bite, then I'm sorry. So that is a viperoid bite, and if it's a neurotoxin, there are neurotoxic snakes include cobra. So all that suggests a neurotoxic bite. So that means the symptoms of the patient would be neurological symptoms like ptosis would be there, or any other neurological deficits. So that means that's a neurotoxic snake. And if it is a myotoxic snake, that means mostly it will be sea snakes are mostly myotoxic. So if it's a myotoxic snake, then that means a patient would have the myotoxic symptoms, which is muscle pain, rhabdomyolysis. So the urinary output of the patient would be reduced. So we have to, if the patient is showing such symptoms, then that means it's a myotoxic bite. However, it does not help in, since we have only one type of anti-snake venom in India, even if we differentiate, it is going to help in administering the ASV immediately. It won't help, it can help in categorization between a dry bite and a poisonous bite. That's it. It's not going to change our mode of management. So after reassuring the patient, you can check for these symptoms in the patient, and then depending upon the symptoms, you also immediately when the patient comes, you also have to take the blood of the patient in a vial, so that we can check for whole blood floating time. So after symptomatically assessing the patient, the investigations done are whole blood clotting time. You can also send for PT-INR and basically PT-INR and whole blood clotting time. And then if at all there are any indications for administering the anti-snake venom, that is if the local reaction is severe, if the edema is crossing one joint, or if there is ptosis for the patient, that is neurological signs like ptosis, etc. is there, then you can start immediately. You have to start administering the anti-snake venom. Okay. And the venom that is given, the ASV that is given, you can give 10 vials of ASV, and that is given over 1 hour. That's what we do in the hospital. It's given within 1 hour, 10 vials you can give. And after 1 hour, you have to again clinically reassess the patient, and you also have to keep serially monitoring the blood parameters as well. So depending on that, along with the ASV, you have to also administer injection Avil, injection hydrocortisone. 200 mg you can administer hydrocortisone, and you can also give a dose of shot of Phenergan. So along with since the reaction of the ASV can be bad sometimes, so it's better to administer these 3 drugs along with the ASV.
Wonderful. Excellent. Now one good news for you who want to discuss. As third boy doctor who has got selected was Abhishek, and I got the news that today one more candidate, like 4th candidate, has got selected for AFC from PD classes. It's a good news for all of us.
Oh, nice.
Again, I'm going to ask you one common question, because I have seen that these are the common questions which are being regularly asked. Like, introduce yourself, this is very common. Snake bite is very common. Now I'm asking you another question which is quite different from your studies. What qualities would you expect from your juniors, nursing staff? So what would be your answer? Try, please.
the qualities that I would
Expect
from my
juniors.
The nursing staff. Sir, I would expect the nursing staff working along with me to be dedicated. And one thing is dedication. Second thing, that they should know their jobs and they should be very quick at what they're doing. That is the second thing that I would expect them to do. And third thing is that I would expect them to be
Yes.
mainly these two things.
Okay, no worries.
I want them to be quick and I want them to be dedicated.
No problem.
Those are the things.
You are trying your best. Now today I'm giving you the questions which are asked on 22nd December 2021 by Board 3. Like yesterday the questions which were asked, today I'm discussing with you. Now tell me,
Okay.
what is acute appendicitis? Speak on this.
Sir, speaking about acute appendicitis, it's an inflammation of the acute appendicitis is an inflammation of the appendix.
It's a very common because itis word itself says inflammation. Something more, like if we go in depth, what we can speak if such a topic is given to us.
So patient presenting with acute appendicitis would usually the clinical features, like patient would be a young patient, it's more common amongst the younger patients, and the patient would present with acute abdominal pain and vomiting, and those are the symptoms that the patient can present with. And when we examine the patient, mostly there will be a McBurney's point tenderness. So that is a sign that can help us clinch the diagnosis. But it's not necessary that all patients have the McBurney's point tenderness. The tenderness can radiate to the left iliac fossa as well, not just in the right iliac fossa itself. When a patient with abdominal pain comes, you can send for investigations. First of all, you can do a complete blood count. If at all the patient does have appendicitis, so we have to. It's an acute abdomen case, so we have to differentiate between appendicitis and pancreatitis. Sending for pancreatic enzymes will help us in serum amylase and lipase will help us in differentiating between the two. And you can send for a complete blood count. You can send for a urine analysis in order to rule out UTI. And if the patient is sick, then you can keep the patient. The management is that you can keep the patient nil per oral. You have to administer IV antibiotics and IV fluids. And you have to wait for the and also analgesics, IV analgesics, and you have to wait for the pain to reduce. And mostly the pain will reduce, and after keeping the patient nil per oral, and you can reduce the infection that is there, and give a general surgery consultation. And depending on what the surgeon says, you can either admit the patient or you can send the patient home. But if at all, if it's an emergency, like if it's a burst appendix or something like that, then you have to immediately take up the patient for surgery. So then for that, you have to do a pre-surgical evaluation and immediately shift the patient to the OT for surgery.
Enough. And now speak on acute pancreatitis.
Yes, sir. Acute pancreatitis is another cause for acute abdomen, for patient presenting to the emergency with acute abdomen. For acute pancreatitis, usually in the south we see because of in alcoholic patients, so middle-aged patients who are alcoholic present with acute pancreatitis. And for acute pancreatitis, usually the pain is epigastric pain. The clinical features are that the patient presents with an epigastric pain which is radiating to the back, accompanied with vomiting. And if such a patient comes to us, we can immediately again keep the patient nil per oral, give IV antibiotics and IV fluids, and then send for investigations. We send for serum amylase and lipase in order to check for the pancreatic enzymes. And if at all it is pancreatitis, then the enzymes will be elevated and we will get the diagnosis directly. And within a few hours or within 1 or 2 days, the patient would get symptoms. We have to admit the patient, and within 2 days, the symptoms will get settled because we are keeping the patient NPO. and giving IV antibiotics and fluids.
Okay. How is gastric lavage done?
Sir, gastric lavage, okay, how is it done? Practically, okay, fine. So that we insert a Ryle's tube, and after inserting the Ryle's tube, we have to connect the Ryle's tube to fluid to 500 ml NS. We can connect it for and immediately give a stomach wash, and that is how it is done.
And there is a question on management of head injury. So would you like to speak something on this?
Sir, head injury, I'll say what we broadly do here, sir. For somebody who's coming with a head injury, we have to follow the acute trauma life support protocol. So a patient who comes with head injury, mostly the most important thing is that we have to stabilize the C-spine, because mostly the patient with a head injury can have a cervical spine injury also. So first step is that we stabilize the cervical spine by giving a cervical collar, and we stabilize the spine, and then we go for our airway, breathing, circulation, and disability, ABCD management itself. And so after stabilization of the spine, we make sure that we insert two large 18-gauge cannulas can be inserted, and post that we can push in fluids. If at all the patient is in hypotension, you can push in fluids. And immediately, if the patient is bleeding, because bleeding can be there, and we have, for controlling the bleeding, we have to give Trenexa 1 gram over 10 minutes is what is given, and then 1 gram over 8 hours. So Trenexa can be given for controlling the bleeding. So that is airway. Breathing, we have to check whether the patient is having any kind of pneumothorax or any cardiac tamponade or something like that. So breathing, airway breathing, circulation, and the disability. For head injury as such, after stabilizing the C-spine, after the cervical spine, we can send the patient for a NCCT, CT brain, so that we can rule out any hemorrhage in the brain, that is SDH or SAH or EDH. So all these three can happen in head injury. And another thing is that we have to, the secondary cause, the secondary injury, that is first primary is hemorrhage, and the secondary will be raised intracranial tension. So if there is raised intracranial tension, then you have to take steps to reduce the intracranial pressure. So give oxygen to the patient, and then you have to give IV mannitol, which will reduce the central venous pressure. So IV mannitol can be given, oxygen, IV mannitol, and the fluid therapy I already said.
Okay.
That is what we usually do for.
There is a question on vaccine vial monitor.
Vaccine vial monitor. Sir, I'm not very sure about vaccine vial monitor. I only know that there is a vaccine vial monitor for every vaccine that comes. It is to check whether the vaccine is usable or not. Okay. So depending upon there is a circle and a square. So depending upon whether I think when it's black or something, then you cannot use the vaccine. I'm not very sure about that.
Doesn't matter. We'll prepare later. Accordingly, we'll give you time. Yeah. There is a question on test on water quality, even without any facility, with naked eyes also.
Yes, sir. These two questions, community medicine questions, yes, I'll have to check, sir. I do not know.
And what about immunization?
Yeah, immunization. Immunization for the children, no, like National Immunization Schedule.
Yes.
Yes, sir. So, immunization schedule, there is at birth you give. So that is what you want, no? Like
actually, what is happening? There is a question which has come yesterday from EMC, from one of our student only. That is based only immunization is written. So accordingly, I think they may have given only the word immunization. Then we have to speak.
Yes, sir. It must be immunization schedule itself.
So
the immunization schedule in India, at birth, when the child is born, you give a BCG vaccine. you give OPV and you give hepatitis B. And then at 6, 10, and
Is
14
it
weeks,
only with the child, or like nowadays also we are getting a vaccine? Is it also immunization or not?
no, sir. In the
This is
National
different.
Immunization Schedule, yes, sir. The immunization that we are getting is COVID immunization, no? So that's
Yes,
why I got a
yes,
little
yes,
confused.
yes. Then it must, if
Yeah.
they want to ask about COVID, then they would have written also. Tell about COVID immunization, isn't it?
Yes, yes, sir. Yes, sir.
Okay.
So this is National Immunization Schedule.
Even different
that is
question is
followed in-
there. No problem. If you know, then okay. Just I
Okay.
want to give you the feedback. There is another question which is quite new. What do you think of the cons in your boss? Like there are two words, pros and cons, advantage and disadvantages, good and bad. So what are the pros and cons? Here the question is, what do you think are the cons in your boss?
in my boss. You mean in the boss with whom I'm working right now?
You can use, you can even with the seniors and with your people, those who are working seniors, anybody.
Yes, sir. So the cons that I felt personally, one thing is that many of the people are not updated. With the latest, medical science is ever evolving. So
Okay.
many people are not updated. So that is one thing. And the second thing, lack of empathy.
Okay. There is a question, HAPE, HEP.
Yes, sir. That is high altitude pulmonary edema. So I'll have to read up on that.
No
We don't
problem.
see those cases here, no? It's like in Kashmir and all, you get, because of the high altitude, you get some breathing difficulty. That's pulmonary edema. So I've never seen such cases.
No
so
problem.
I'll
Go
have
through
to read
this.
up on that. Yeah.
Because as you know also, this is a question was asked even from one of your friend only.
Yes, sir. Yes, sir.
And what about
Yes, sir.
intubation?
Yes, sir. Intubation, sir, with just the word intubation, I don't know whether they mean the steps of intubation. I don't know what they mean by that. But intubation is the procedure that we do when you cannot, breathe. Like that is when the GCS indications for intubation is like when the Glasgow Coma Scale, that is GCS score is less than 8, or if the patient's saturation drops to less than 80%. Or something like that, then we intubate the patient. So intubation is done by using a laryngoscope.
Okay. Today our Dr. Dinesh has got selected.
Oh, okay.
There is again a question, ethambutol. There is a question on this. Ethambutol.
Yes, sir. Ethambutol is a drug that is used for TB.
Okay.
Yeah, it is used in the primary management of tuberculosis. So tuberculosis regimen is 4 HRSD plus 6 HRE. So 4 HRSD means isoniazid, rifampicin, ethambutol, and streptomycin. So ethambutol is one of the main drugs that is used for TB, for management of TB.
Okay.
And the main side effect of ethambutol is optic neuritis. So these are the two things that I know about ethambutol.
There is another question, duties of MO. I think medical officers.
Yes, sir. So duties of a medical officer, if it's a government hospital, then the medical officer has to see usually would be posted in a casualty, and the medical officer has to see all the emergency cases that come to the casualty. They also have to deal with the medical legal cases that come, like assault, rape, abuse, and all those things. And third thing is the auditing that is there in the emergency department. So the officer also has to be a part of that. Then if it's a secondary hospital. If it's a primary, if it's a PHC, then the medical officer also has to take care of the health of the entire community of that area. So the medical officer also has to go for field visits, and immunization days will be there. Those days the medical officer will have to be in charge of the immunization. So those additional duties will also come if the posting is in a peripheral center.
Okay. There is another question, that is your strengths and weakness.
Yes, sir. So my strengths are that I'm very confident and adaptive person. So I feel like I can I can adapt to any situation that you put me in, and those are my strengths. And my weaknesses are that once I started working, I feel like I haven't given too much importance to physical activities. So I should get back on track with exercise. One thing, and second thing, I feel that sometimes I get too much involved in my work, and I'm very workaholic, and I feel like I need to keep a balance. So that is the second weakness.
Next question is very interesting, doctor. You will definitely love to answer.
Yes, sir.
How do you find your sir, PD classes? ManojSharma sir.
Sir, you have been very, very supportive since the beginning. Like, what stands out the most is that you are very cheerful. So you made me very comfortable from the beginning itself. So that is one thing that I want to tell you. So
Okay. Now come on, we'll have this session, next session.